Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Hello and welcome back. This is Adam Rosen, and you're listening to the Total Knee Tips and Pearls podcast. On today's episode, I just want to talk briefly about a simple little trick that I came up with when I started practicing. And it's because this actual topic just came up the other day with one of my fellows. You see, about a week or so ago, we had a day, and it wasn't really a hard day. It was actually only a few cases. We had 3 total joints, but each one of those primary total joints was hard and difficult because all of the patients that day were large. One knee had a bit of Baja. The other one was sort of this fibrotic muscular, which made it hard to expose. So although there weren't any revisions and there weren't any major technical difficulties, at the end of those days, physically and mentally, you're tired, you're exhausted. It's a whole lot more kind of time-consuming, physically consuming, mentally consuming than having like 5 straightforward varus knees in thin patients. So you need some sort of way of recognizing this. And I ran into this problem in my first year of practice. And what had happened was I had a day, and it was really similar to this. And I had a day where there were 3 total joints, and they were just all a bear. They were all big patients, muscular patients, fibrotic patients, limited range of motion patients. And I remember being there all day for 3 joints, and I was exhausted physically and mentally. So I needed to come up with some way to recognize how to schedule patients in a way that I didn't get stuck on one day with a whole bunch of easy patients and another day on all the hard patients. Because my scheduler, as great as she is, doesn't always know the difference between, total knee, total hip, hard versus easy. So what I came up with back then is the STAR system. And, you can use any way that you want to, but for me, it was quite simple. And what I would do is at the top, I would add 1 star or 2 stars or 3 stars. So 1 star was your typical straightforward varus knee skinny patient. 2 star maybe limited range of motion, maybe a hard valgus knee that has some instability. Maybe you're doing a hip and the patient's moderately obese or has a bit of dysplasia. And the 3 stars, these are the larger patients, or maybe you're a 55-year-old muscular male hip, or bad patella baja with a prior tibial plateau fracture. So things that are definitely going to be more time-consuming, more energy expending, more mentally taxing than your routine total joints, although they're still a total knee and a total hip. And it was nice because we were able to say, okay, if you do have a 3-star case on this day, let's make the rest of these 1 stars, or maybe like a 3-star to 2-star and the rest 1 stars. But it allowed my scheduler to really take a look at the schedule, and instead of just booking 3, 4, 5 joints on one day, she could stratify which days are the hard cases and try to divvy those up on individual days, as opposed to by accident looking at the schedule for this week and going, oh crap, I have a huge day. I only have 3 or 4 joints, but they're all hard. Because you'll see that, at the end of a long trauma case, you got lead on, you're hot, you're sweaty. But what you'll start to notice as you get further on in your training, and especially when you get into practice, is there's a mental aspect that's very taxing. And these are things even in your straightforward, cut, trial, balance, perfect implant, you're still thinking a lot. Soon as you get into a case where you have to do more releases or recuts and balancing, and there's osteophytes and there's limited range of motion, or a hip that's, difficult to balance, and you're going through some of the steps multiple times to get that joint just perfect. Those are mentally exhausting at the end of the day. And then you leave the operating room and you go home and you're just wiped, physically and mentally. So what this does is it just allows you a very simple way to communicate to your staff, hey, this is a hard one. Don't slam me with a bunch of other hard cases on that day. And this way they know how many cases to put on. They can limit it if there are some hard cases. And if they're all easy 1-stars, because you have a lineup of those, they can really stack those cases in one day, knowing that you're going to get through it in a reasonable time. So just a simple little tip and trick. I've talked about this, I think, briefly early on in season 1. But actually, since this did just come up, it was very pertinent timing-wise, just to bring this up again and make sure that, as a resident, you don't always have the ability to alter the schedule, but something definitely to keep in your mind as you enter into practice, that you can start to formulate a way to make sure that your days become fun and reasonable, and also that you have the strength and the mental wherewithal for a really, really hard case, as opposed to, being exhausted at the end of the day and not being at 100% for that last case because you've had 2 or 3 really, really hard cases leading up to that. So put this away in that bag of tricks for, when you get out into practice. I do believe it's going to help you. It's going to make your life a whole lot easier. And also for your family, it's going to make you a whole lot more enjoyable when you come home at the end of the day. So in the meantime, stay safe. For all of those residents that are interviewing for your fellowships coming up, good luck. And until next time, I'm Adam Rosen. You've been listening to the Total Knee Tips and Pearls podcast. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.